So one of the treatments that's used not very much in myeloma is an allogeneic stem cell transplant in patients who develop graft versus host disease. We've known for a long time that those kinds of patients can develop eye problems primarily through what appears to be sort of a destruction of the lacrimal glands. But more recently, with the advent of belantamab, we're now seeing patients who have what's called keratopathy. And keratopathy covers a number of symptoms that can be caused by these antibody drug conjugates, the one that is approved, belantamab, and that can be things like just some dry eyes or irritation. People can get trouble with bright lights, what we call photophobia. And this can happen at a fairly high incidence in patients receiving belantamab, somewhere around 60 to 70% of patients. Most of the time it's mild, and most of the time if the drug is held, the symptoms resolve, which is great. So there was a small study looking at the use of steroid eye drops to try to mitigate belantamab side effects in terms of the ocular issues, and that did not appear to be successful. Right now, what's really advisable is for patients who are receiving belantamab to use hydrating drops. We recommend that, usually preservative-free ones. There are some people who are looking at a special eye drop called lifitegrast, whether that may be some benefit. We do recommend that patients receiving belantamab don't wear contacts. We think that that can make some of the eye irritation worse. Right now, this is an area of intense research about whether there's a way to eliminate the keratopathy. One thing that may be important is actually for patients who are on belantamab, holding the dose for a period of weeks can be helpful. And often lowering the dose is also helpful for this side effect. And in the majority of patients that I've treated, using those two strategies has actually not impacted on their response to the drug, that they continue to respond well to the drug.